Hi, welcome to Ames Responds to COVID-19. This is a question and answer program where Ames area organizations respond to COVID-19 questions. I'm Susan Guiazda, the Public Relations Officer with the City of Ames. We have several questions that have come to us this week, and we have several guests available to respond. If you have a COVID-19 related question, please call our City of Ames hotline, 515-239-5670. Or you can always email us at covid19@cityofames.org. We will try to get your question on our next show. So, our first question, I'm going to kick over to John Dunn, the Director of Ames Water and Pollution Control. John, this question came in about COVID-19 and could that virus be transmitted through the water?
Well, tap water is absolutely safe to drink. What we understand about this COVID-19 virus is that it belongs to a family of viruses that are known to be especially susceptible to conventional disinfection methods like chlorine in drinking water. We also know that it's susceptible to ultraviolet disinfection, which is the type of disinfection that's used at the Ames Water Pollution Control Facility. So any viruses that end up in the city's wastewater are being inactivated before they're released back into the environment.
It sounds like you're doing a lot to ensure that we have safe drinking water.
Yeah, protecting public health is the singular focus that we have. That's the reason that we exist as a department.
So how are you ensuring that city water city employees don't get sick who staff the water plant?
Well, we've done a number of things. We've done a huge level of segregating staff. For example, at the drinking water treatment plant, the operations staff stays up on the second floor and the administrative staff stays on the first floor. They're coming in completely separate entrances. They're using completely different break rooms. So we've got them completely segregated. We've changed a lot of our routine practices. So, for example, when we're changing people's water meters, we're actually not coming into private residences to do that. When we're collecting drinking water distribution samples around the community, we've stopped going into private homes. We've stopped going to long-term care facilities or daycares. We're still taking all of those same number of samples every month that we always have, but we're going to more isolated locations, like taking them at the water towers and other locations that don't require us to go into someone's home.
Wow, sounds like you're changing the way that you're doing the business, but you're still doing the same stuff.
Yeah, that's right. The demand for what we do is still there. Having safe drinking water is just as important, if not more important, at this point in time.
Thanks, John. I think you've answered that question really well. Our next question, I'm going to kick over to Story County Public Health, where Teresa Ferrari is waiting. Teresa, how does the COVID-19 positive patient information get conveyed to the state of Iowa?
Well, first of all, it gets conveyed to the healthcare provider, and then they report it to the state of Iowa, and then the state of Iowa then reports it to us.
How come it sometimes seems like people talk about perhaps a lag in between people that they hear might have tested positive and the numbers that we're seeing statewide?
Well, because Iowa Department of Public Health only reports it once every 24 hours. So depending on the time of day that positive person has come through, it may not get on till tomorrow. And also, a lot of places are using different sites to send their tests to, like LabCorp. And sometimes those can take up to 4 to 5 days to get the results back. And those are not necessarily, those don't automatically go to Iowa Department of Public Health. That would strictly rely on the doctor to let them know. Because if it's sent to the hygienic lab, those automatically go straight to the Department of Public Health, so they know about those right away. So that sometimes there's a lag because of the reporting only once to 24 hours, and also because they're sending off to different labs that take a little longer.
So do you feel confident that the numbers are getting reported in a timely manner?
I do, yeah. I do, because we are notified of every positive case in Story County, and we keep track of that. And I feel like, yeah, I do. I have noticed, a little bit. It's like, well, they were tested 4 days ago, But now we find out 4 days later, and that was just because they sent it to like LabCorp. And like I said earlier, that takes a little longer. But I do feel that confident that we are getting reported of all the cases.
Well, and I found the Iowa Department of Public Health website to be extremely easy to use and, like you said, updated regularly. Where do people go if they want that information to read for themselves?
There's a COVID-19 dashboard, and it's you can go to coronavirus.iowa.gov. And then there's a dashboard, which is very user-friendly, and you just click on the different, whatever you're interested in seeing. You can find out the number of cases and what counties and that type of thing.
Yeah, that's pretty amazing data, and it's available. It's updated every day. And if people have concerns, it seems like a good place to go.
Right, it is, yes.
All right, Teresa, thank you.
Sorry. I was just going to say they're doing a great job on keeping everything updated, and things are changing all the time. So it's definitely a site that you want to look at on a regular basis because things change.
Well, thank you for that information. We're going to go to Story County Board of Supervisor Linda Merkin for our next question. Linda, how does the Board of Supervisors act as a liaison between cities and the county? And this is a two-part question. And how would that help if we had a surge in COVID-19 patients?
What we have is a body that already communicates between the county and the cities, and that's the Emergency Management Commission. And I and the sheriff represent the county on the Emergency Management Commission, and then all the mayors of all the cities in Story County. So we have 15 mayors, the sheriff, and myself. We meet quarterly in normal times and do the business of the commission. We help guide planning by our staff, and we also and keep ourselves informed and know what's going to, what the plans are in case of emergencies. Since the Emergency Management Commission has been, the Emergency Management Agency has been working nonstop right now through the Emergency Operations Center in planning for COVID-19 response. We have also had all the members of the Emergency Management Commission, the mayors, the sheriff, myself, plus people from Iowa State University and from the Story County Public Health Department meeting weekly on a Zoom meeting such as this, just to share what's going on. So everybody knows what are the challenges that are being faced by the larger communities, by the smaller communities, by the university, by the county, in the unincorporated areas. So I just think we're fortunate. We already had a whole lot of relationships between the county and all the other entities in Story County. So we're just building on that. We're keeping in touch. The Emergency Management Administration has done a whole lot of planning with public health. And we've also had the Chamber of Commerce involved in some of our calls so we can get information out to the communities about what the financial packages are that are coming through. So it's been a good communication, and I think that's the really important thing, in a time like this, is that we communicate what is going on in our own jurisdictions, because we're all responsible. The county's responsible for planning in the unincorporated areas. All of the cities are responsible for emergency planning within the cities. And Iowa State, has its own emergency operations center and is responsible for that. But we all know we share problems. We all know any jurisdiction can get overwhelmed, and we need to work together. And that's what the whole thing is about, is working together to help solve the problems when they come up.
Well, that's a great answer, Linda. I'm just going to have to ask, have you ever been in so many meetings?
Different meetings. I have never been on so many Zoom meetings. It seems like every time I look at my calendar, there's another one coming up. Another supervisor said something today about how many different kind of meetings have you been on? And I had to say mostly Zoom, but she had been GoToMeeting on WebEx, and it's amazing. It's just amazing how we are getting the work done of government, and we're taking care of our residents all over here in different ways, but government's continuing.
Yeah, that's great to hear about the collaboration. Those of us in the business know that it happens, but I'm not always sure that our residents are aware of it. And so thank you for just explaining that process.
Thank you for asking.
So for our final question, I'm going to toss it over to Assistant Vice President for Student Health and Wellness, Aaron Baldwin with Iowa State University. Aaron, this question seems to fit within your area of expertise. Public health officials continue to emphasize the importance of social distancing, but how does this really help?
So even if we're otherwise healthy, we're still at risk, and we could increase that risk for others. So by all of us doing our part, we can help slow the spread of COVID-19. And basically what we're trying to do is flatten the curve, which means that we won't overwhelm the healthcare system and that will ensure everyone can access the care that they need. So social distancing, or what we like to call physical distancing, can help facilitate this. Physical distancing can be a bit confusing. So what we mean by this is taking strategies such as working from home, if that's possible, staying at least 6 feet from other people, not gathering in groups, and staying out of crowded places and avoiding mass gatherings. And I think that's one of the biggest challenges. So that includes things like private places, public spaces, friends' houses, parks, restaurants, stores, or any other places. And it applies to everyone, including our teens and younger adults. And our children shouldn't be having those in-person play dates while school is out. However, physical distancing does not mean that we should avoid staying in touch with our friends and family that don't live in our home. So we need to make sure that we're calling, video chatting, and staying connected using social media. We all certainly react differently to stressful situations, and having to physically distance ourselves from someone, the people that we love, could be really difficult.
Well, you kind of answered another part of that question is, how do we maintain our physical and mental health while we're social distancing? You mentioned staying in contact. What are some other suggestions?
It's okay to not be okay. This is a really stressful situation that we're all experiencing challenges in all sectors of our lives. So we want to encourage everyone in our community to focus on their well-being and find different strategies that bring them joy. CycloneHealth.org has lots of links to resources from our Student Health and Wellness Unit departments. And even though that focuses a lot on student well-being, a majority of our resources can be used by anyone in the community. Specifically, I want to highlight our Cyclone Health virtual resources. You'll find lots of different activities on there. There's virtual fitness classes. Our Keep Community Stay Informed, Be Well campaign is up there. And it has ideas like how to host virtual get-togethers, Netflix parties, animal webcams, virtual tours, field trips, coloring pages and activities for our kids. There's also resources from our student counseling services. They have a video series up that has different mental health topics, such as how do we practice self-compassion, how do we focus on our daily rhythms and routines. And last, just want to mention our ISU Extension and Outreach website. It has many great resources and topics, anything from childcare to food access, eating healthy on a budget, finance, mental health and well-being, and parenting.
Those are some great resources, and one thing a lot of people have right now is some time to look at them. So great idea to check out those resources on the web, and some just nice ideas to stay connected with one another. Thank you, Aaron, and thank you to all our panelists, John Dunn, City of Ames Water and Pollution Control, Teresa Ferrari, Story County Public Health, Linda Merkin, Story County Board of Supervisors, and Aaron Baldwin with Iowa State University. Just a reminder that Ames Response to COVID-19 is an opportunity for Ames residents to ask their questions and get answers. If there's something you're curious about, let us know. We'll put together another program for next week. Call us with your questions at the city's hotline, again, 515-239-5670, or email us at covid19@cityofames.org. That's our show for today. Thanks for watching.